Good evening, I'm Michael and you're watching Kini News, the show that brings you today's biggest stories. Malaysia has passed the 4,000 mark for the total number of COVID-19 cases in the country. Though there are many new cases in the past 24 hours, the number of recoveries were higher. Malaysia has reported more recoveries in the past 24 hours than new COVID-19 cases. Health Ministry Director General Dr Noor Hisham Abdullah said 166 recoveries were recorded, with 156 new cases being detected. This puts the total number of cases at 4,119, with 2,567 of those cases still active. 2 new deaths were also reported, bringing the death toll to 65. Dr Noor Hisham warned that the non-compliance of the MCO will be a heavy price for Malaysians to pay.
Didapati semasa tempoh Perintah Kawalan Pergerakan, masih terdapat aktiviti pergerakan yang tidak dibenarkan serta aktiviti kunjung-mengunjung ke rumah saudara mara termasuk mereka yang tidak sihat serta mereka yang sedang menjalani home surveillance. Misalnya, bagi kes kematian ke-64, beliau dan beberapa orang lain telah meneruskan perjalanan keluar kawasan iaitu kedua negeri meskipun Perintah Kawalan Pergerakan telah dikuatkuasakan mulai 18 Mac 2020.
We constantly report on the new number of cases. And have you ever wondered how these cases are detected? Better still, let us show you. Our very own Daniel Anthony got a tour.
Hi, I'm Daniel Anthony. I am here at the UiTM Institute of Medical Molecular Biology, one of the few centers in Malaysia where COVID-19 samples are sent to be tested. Now, these samples are extracted from patients who are being tested for whether they are COVID-19 positive or not. Right behind me is the counter where these samples are first brought in and collected, and in a moment we'll be heading upstairs to the laboratory where the samples are extracted and then tested to determine whether one is positive or not.
Area saja dia akan berhenti lah.
Professor Dr Ariza Adnan leads the Special Task Force for COVID-19 Laboratory in the UiTM Medical Molecular Biology Institute. Her daily grind, along with her staff, is the painstaking testing of hundreds of samples. COVID-19 testing is done through the analysis of 2 swabs taken from a patient's throat and nasal cavity. The first part of the testing is the cleaning and inactivation of the virus through heat, which takes place here in this room. This is the most dangerous phase of the process as it involves handling the possibly infected samples, and great care is taken to ensure that contamination or infection does not occur.
So this is sorting, which normally takes between 2 to 3 hours. Over about 50 samples, we process about 2 to 3 hours.
Once done, the inactivated samples will be sent to the specimen extraction room. Here, the most tedious part of the procedure begins, manually extracting crucial DNA from the samples. As the laboratory is not equipped with an automated extraction system, the process is slow, and one mistake could mean having to repeat the procedure.
So if we have an automated DNA extraction system, we can process about 48 samples in 70 minutes. At the moment, they're processing 40 to 50 samples in 2 to 3 hours. Yeah? So speed matters, and this is also one of the setbacks that why sometimes you don't have results very fast. Yeah?
Here in the largest part of the laboratory, reagents are then mixed into the extracted DNA to perform a test known as a polymerase chain reaction, or PCR. A reaction detected would mean that a sample is likely to contain the genetic material from the COVID-19 coronavirus and would indicate a positive case.
If it is positive, means the virus is there.
Yes.
Yeah. So it is presumed that you are contagious lah. We strictly follow what yang disarankan, recommended by KKM, as you know.
Yes.
The reverse transcriptase, real-time polymerase chain reaction, is the gold standard to detect for active infection, and that's what we are using now.
The painstaking diligence and cost required for RT-PCR is what sets it apart from some rapid diagnosis kits, which have a success rate that maxes out at a mere 56.6%. For Malaysia, PCR testing is still a very new technology. There is no local authority or certification to perform these procedures at the moment, and thus a very thin workforce.
We do not have such service before. This is a special lab, so we are using our lecturers, and the lecturers are now on the bench doing the work. So this is something that is very unique. They are lecturers, that's not their tugas hakiki, yeah, but they're coming together to do this. We have 2 shifts at the moment, from 8 a.m. to 2 p.m. and 2 p.m. to 8 p.m.
These medical frontliners, along with many more who are working against the clock to detect and contain the COVID-19 outbreak in Malaysia, are the unsung heroes of the battle we now face. Until a reliable and accurate rapid testing solution is developed, these frontliners are the ones who will be doing a huge part in putting an end to this pandemic. Daniel Anthony, KiniTV, Sungai Buloh.
Malaysia and Singapore are currently in talks to iron out some issues with our neighbours' existing screening process. Putrajaya is not satisfied with Singapore's screening method for Malaysians who are crossing the straits back into Johor. This is because Singapore, citing WHO recommendations, is only doing swab tests for those who have symptoms. This is despite Putrajaya asking Singapore to test all Malaysians who want to return after the island state implemented its own semi-lockdown. Ismail said those who have returned have been given clearance letters saying they are clear of COVID-19 because according to Singapore's SOP, they only require basic health screening.
Tetapi kita masih tidak berpuas hati dengan apa yang dilakukan dan kita sedang pun berbincang dengan pihak Singapura supaya rakyat kita supaya dibenarkan untuk terus tinggal di Singapura dan mereka menanggung dari segi tempat tinggal dan juga dari segi allowance harian untuk makan minum dan sebagainya. Saya telah pun memaklumkan kepada pihak Menteri Kanan Singapura, Mr. Teo, mengenai perkara ini. Walaupun seperti kita tahu, Singapura juga tidak berhak untuk menyekat rakyat kita yang ingin pulang.
The screening by Singapore was part of the condition Putrajaya had set to waive mandatory quarantine for Malaysians returning to Johor. Meanwhile, the Health Ministry has advised Malaysians in Singapore to stay in the country. Overcrowding at 2 buildings placed under the Enhanced Movement Control Order is putting the government in a tight spot. About 97% of the residents of the Selangor Mansion and Malaysian Mansion buildings in Kuala Lumpur, which has been placed under the Enhanced Movement Control Order, are foreigners.
Warga asing yang berada di dalam negara kita adalah di bawah tanggungjawab kedutaan asing. Jadi dari segi PKPD 2 ni, ianya melibatkan hampir keseluruhannya warga asing. Jadi kita juga memaklumkan kepada pejabat kedutaan mereka supaya mengambil tanggungjawab ini bagi membantu rakyat mereka yang berada di 2 premis tersebut.
Meanwhile, several units were found to have as many as 30 people living in a single unit. It was earlier reported that there are about 6,000 residents in 365 residential and commercial units in the buildings. But Federal Territories Minister Anwar Musa reportedly said there are nearly 7,000. If that figure is accurate, that means on average there are 19 people in each unit. This has prompted the government to consider relocation of some of the residents to a quarantine centre. Anwar was quoted by Astro Awani as saying that the government may look into this possibility as the density is too high and the Health Ministry had advised to relocate their residents. The Bantuan Perkhidmatan Nasional Aid may be going to certain people it shouldn't be going to. Even MPs have somehow been marked as eligible by the system. Kuantan MP Fuzia Saleh said the government cannot afford to make mistakes with this Bantuan Perkhidmatan Nasional Aid as the world struggles to manage the financial impact of the COVID-19 pandemic. The implementation of the aid may have been exposed to a serious system error. Following news reports that members of Parliament and the former Prime Minister Najib Abdul Razak's wife Rosmah Mansor were among those eligible to receive the 800 ringgit aid, Fuzia said she went online and checked her own personal status. She said she was shocked to find out that she was also approved to receive the aid. She clarified that she was not a recipient of Bantuan Sara Hidup under Pakatan Harapan and she did not apply for Bantuan Perkhidmatan Nasional. Aside from Fuzia, another former Deputy Minister, Mahfuz Omar, was also eligible to receive 1,000 ringgit. He called for an overhaul of the BPN system. Malaysia Kini's checks also confirmed that at least 2 other MPs, Ahsan Karim of Pasir Gudang and Wan Hassan Muhammad Ramli of Dungun, are eligible for 1,000 ringgit and 1,600 BPN aid, respectively. Former Minister Hassan Malik and Deputy Minister Razali Ibrahim were also listed as recipients. This is strange to say the least, because MPs are paid a salary of 16,000 ringgit per month plus various perks and allowances, putting them in the T20 income bracket. Coming up next, 4 countries in the world now have 5-digit death tolls from COVID-19. And US President Donald Trump has slammed the WHO. All that and more after this. This next story is brought to you by Blue Air. France is now the 4th country in the world to record a 5-digit death toll with over 10,000 deaths. France has officially registered more than 10,000 deaths from the coronavirus infections, making it the 4th country to cross the 5-digit threshold after Italy, Spain and the United States. Health officials said that the pandemic was still expanding in France, which is now in the 4th week of a national lockdown to try to curb its spread. French authorities tightened their lockdown measures in the capital on Tuesday by banning outdoor sports activities between 10 a.m. and 7 p.m. daily. The move came after many French politicians and doctors expressed dismay at the fact that the streets of Paris still featured people jogging or congregating near markets, despite government orders to get people to stay in as much as possible. The French Prime Minister said the unwinding of the lockdown, which is supposed to run until April 15th, would not happen overnight. Meanwhile, Wuhan ended a 2-month lockdown on Wednesday, allowing people to leave the city. China sealed off the city of 11 million people in late January to stop the spread of the virus to other parts of the country. Over 50,000 people in Wuhan caught the virus and more than 2,500 of them died according to official figures. Around 55,000 people expected to leave Wuhan by train on Wednesday. More than 10,000 travellers had already left the city by plane as flights resumed at Wuhan Tian Airport. Flights to Beijing and international locations have not been restored. While the world scrambles to contain the COVID-19 outbreak, Donald Trump may be looking to contain the World Health Organization. US President Donald Trump slammed the World Health Organization of its handling of the COVID-19 outbreak and has accused it of siding with China at a White House press briefing on Tuesday.
The WHO, that's the World Health Organization, receives vast amounts of money from the United States. And we pay for a majority, a biggest portion of their money. And they actually criticized and disagreed with my travel ban at the time I did it. And they were wrong. They've been wrong about a lot of things. And they had a lot of information early, and they didn't want to, they seemed to be very China-centric.
Trump also said he would be looking to stop the US from funding the UN Health Organization.
They really called, I would say, every aspect of it wrong. And they seem to err always on the side of China. And we fund it, so I want to look into it. Yes, please.
Thanks. A quick follow-up on that. So is the time to freeze funding to the WHO during a pandemic?
No, maybe not. I mean, I'm not saying I'm going to do it, but we're going to look at it.
You did say that.
We give a tremendous, no, I didn't. I said we're going to look at it. We're going to investigate it. We're going to look at it. But we will look at ending funding. Yeah.
US conservatives have increasingly criticized the WHO during the global pandemic, saying it relied on faulty data from China about the outbreak of the novel coronavirus. So far, the US has reported close to 400,000 COVID-19 cases and over 12,000 deaths. And that is all from me today. For more stories, you can go to KiniTV.com. You can also follow us on Instagram, Twitter, YouTube and Facebook for the latest news updates. I'll see you again tomorrow, same time, same place. I'm Prasad Michael. Thank you for watching.